Good afternoon and welcome. Last week, we answered questions, high-level questions on how to bring your workplace, your workforce back safely to work and to implement a healthy workplace return to work plan. I am Catherine Clark, and Linda Wardell, who was scheduled to facilitate this session, got called away, so I will be facilitating. Today, we will be talking about more in-depth plans on how we can implement a safe return to work plan. And we will also introduce you to detailed questions that you may ask yourself to guide your planning process and implement your plan. Today we have Dr. Kurt Hegman, MD, PhD, as he's a board-certified physician specializing in preventive, occupational, and environmental medicine. He directs the university's Rocky Mountain Center for Occupational and Environmental Health, one of 18 centers in the U.S. He completed medical school at the Medical College of Wisconsin. He completed 2 residency programs, one in internal medicine and the second in occupational medicine. Welcome, Dr. Hegman. And we also have Dr. Matthew Hughes. He's also an MD, MPH. He is also at the University of Utah Rocky Mountain Center for Occupational and Environmental Health. Dr. Hughes has more than 20 years of experience helping companies manage corporate health programs for many Fortune 500 companies, including large companies such as BP, Marathon, P&G, Hinkle, Union Pacific, Chevron, and others. And just to introduce you to me, I am Catherine Clark. I'm Senior Vice President of Safety and Health at WCF Insurance. I'm also the Chief Risk Officer there. I have over 25 years of experience in occupational safety and health. And I have the fortunate calling of being the leader of our safety and health team there. And with that, I will start with a little introduction of what an overall plan would look like, to give you kind of the idea of what the elements of your safe return to work program would look like. And with that, would you advance the slide, please? So what we have done at WCF with our plan is we have utilized the model of a systematic approach, a management system, safety management system. And it involves plan, do, check, and act. So in each section of the plan, we are looking at, what are we going to do? What are we doing? Check it to see if it's working, and then we act upon that and start the whole process over. And as you're doing your return to work plan, it's really important that you be prepared to make changes and be fluid to make sure that you are incorporating the things that you need to make sure that your plan is effective. We have 5 phases in our plan. The first phase is planning. The second phase is training. Then the actual return to work and the reporting that goes with that. And then we will be evaluating it, and then we start the whole process over again. Just because you're doing a plan right now doesn't mean that your plan will stay the same, because as you get new information on the virus, the coronavirus, you'll want to make changes to your plan. Next slide, please. So our process includes screening and testing and reporting. We will plan on screening our employees, whether it's temperature screening or COVID testing. We plan on doing all of that, plus a way to report that. We will be using social or physical distancing is what I like to call it, because we need social interaction, even if it is through a Zoom meeting. Physical distancing, it's really important to maintain that physical distancing because of the way the virus spreads. And then the third portion is personal protective equipment, especially masks. We know now that the virus is spread primarily through the air, so the masks are very important. And then gloves, eye protection, and protective clothing if needed, depending on your facility and your process. So basically, you need to have your plan needs to answer the questions who, what, where, when, and how. How are you going to implement this plan? Next slide, please. So we have utilized the information that the Utah Leads Together Plan 2.0 plan has. There are a lot of good and helpful resources that are included with this plan. Next slide. And in that plan is a color-coded process, basically indicating, you know, a high risk. Right now we're in the high risk, but we're anticipating that we'll be going to the moderate risk in the state of Utah this next week. And then low risk, and then almost back to the normal. I call it the new normal for green. Next slide, please. With that plan that the on the Utah website is the phased guidelines for general public and businesses. This will be updated. In fact, I believe it'll be updated sometime after this week with new information as it becomes available. But this really provides helpful information for specific business types with ideas of how to best bring your employees back to the workforce. Next slide. This shows you that it has tiered recommendations for the businesses and employers that are based on the different risk levels, and it gives recommendations on how to best provide a safe workplace for very specific industries. Next slide. So this is a list of resources. It's a little bit different than the list of resources. There's a couple of same ones from last week, but there are additional ones on this as well. You can find the Utah Leads Together 2.0 at this site, and also the CDC is a good place to go as well. And then the OSHA guidance for preparing workplaces for COVID-19 is also very good. These are just places that we can go for additional information to help you know what you need to put in your program. And with that, I will turn the time over to Dr. Heckman to begin his portion of the slideshow.
Okay, great. Thank you, Catherine. Appreciate it, and good afternoon to everyone. What we're going to do is do deeper diving now into a few of the areas and give you some examples, photos, a lot of things that you can look at later. Some of these we'll go through fairly quickly. So if we can go to the next slide. What we are going to first briefly mention is, depending on the size of the business, clearly you'd need to end up with having somebody in charge and with established coordinator, authority, communication flow, chain of command. And then also one would get involved with not only your employees, but then also clients and vendors and those sorts of things who may come in and out of the workplace, because you do want to make sure that you're not importing risk unnecessarily to keep your workplace safe. Next slide, please. Next slide, please. Thank you. Okay, so one of the things Catherine mentioned, which is important, is we want individuals who are symptomatic to not be in the workplace. In the past, probably all of us have more than once gone into work with symptoms of a common cold. This is not the time for that. This is the time for those individuals to report those symptoms and not come into work. You've got consideration for temperature checks that could be done by the individual at home. And then with not coming into work, of course, they have elevated temperatures. And as some of these things evolve, of course, current guidance needs to be followed. Next slide, please. Next slide, please. Now, if you recall, initially, the emphasis back 3 months ago, a time and eternity ago, were on hand washing and contact spread. Subsequently, emphases have switched to droplet spread, which is the 6-foot distance. And then there are some concerns now about aerosol spread, which is beyond 6 feet to 20 or even more feet than that. We'll show you an example of that. Next slide, please. These have some implications, of course, in terms of hierarchy of controls. The current thought is the primary spread is by droplets. There is some evidence for some aerosol spread, and so we'll show you an example of that in a moment. And certainly we do think that there is some spread by contact. So basically a respiratory as well as a contact spread are thought to be important. And this, of course, then also provides some hierarchy in terms of which interventions are likely to be more successful. Next slide, please. So this is a CDC study of a restaurant in China. The layout of the seating is in the above panel. On the right, those rectangles are air conditioning units. The solid lines are airflow coming from the air conditioner unit going towards the left of the screen. The dotted line is the return path of flow. And what happened is, in the bottom half of the screen, A1, which is a yellow circle, is a 63-year-old female who 2 days later became symptomatic. So at this point in time, she was actually passing the virus, but it did not know about that. And so what was going on is you can see the spread subsequently, and you can see the spread to these key people and who developed symptoms at what point in time. Next slide, please. Respiratory spread measures is the next thing that we're going to talk about. So next slide, please. So when we're looking at droplet and aerosol exposures, the three main things that we can use for reducing risk are, first of all, distancing, secondly, masks, and thirdly, ventilation. We did mention that briefly last week. The differences between droplet and aerosol are the degree of distancing, the types of masks used, and the type of ventilatory measures. To prevent contact spread, the two main things are hand washing and gloves, of course. Next slide, please. So for social distancing or distancing, we're looking at 6 feet for the droplet spread. Along the way, it is advised that we should generally avoid things like carpooling. If we were in carpooling situations, because you could have somebody spreading the virus, then masks and gloves should be used, and hand washing also after exiting the vehicle. The same applies for public transportation. And regarding walking in single file, it sort of depends on the direction of the wind. If it's sideways, you're in great shape. If it's longitudinally, then it can just spread from one person to the other. So some consciousness about the ventilation, including outside, is actually relevant, including when you're walking. Hopefully you're doing other exercise to maintain your mental health. Next slide, please. We're all familiar with the markings in the supermarket, I think, by this point in time. Next slide. And next slide, please. And there are different ways to mark the pavements and that sort of thing that have been used. The same thing is going on in workplaces. So this happens to be from the center. Our administrative assistant is in the upper left, Tony, and Tony's gone around and put duct tape down. a very simple solution. She wrote 6 feet on it, and she did that around her space, and it's also around others, such as to the right. And she also put signs to remind people about the 6-foot distance. The pink arrow is actually not on the door, but it could be. It would remind people better. Next slide, please. Okay, next slide, please. And this also applies in the workplace. The other thing that, if we can back up one slide, the other thing to note in this prior slide is the button on this mask on the gentleman on the right. There's a good chance, and I don't know this brand, that that's actually an exhalation valve. This would actually protect this worker, but it would not protect the coworkers, because it allows any virus that he would be expiring to more easily go into the ambient air of the work station. So next slide. And with this next one, we're going to pass the baton to Dr. Hughes.
Good afternoon. So I'd like to just talk a little bit about, kind of the pragmatic points of coming back to work. And so the first thing that you want to think about is, how do you integrate people back in, how fast you're going to do that, and whether you can do it over a longer period, or if you need your full staff right away. The other things to think about would be what types of PPE you're going to use in the workplace. So do you have the need for everyone to wear a face covering or a face mask? The difference being the face masks are more the ones you see like for surgical masks versus homemade cloth masks, whether or not people will need to be wearing gloves, or is there any other PPE to be worn, like safety glasses or goggles, things like that. And it all depends on some kind of a risk matrix that you'd want to identify. I'll just go ahead and throw a plug in for one of the links that Catherine Clark had on her slides, which was the guidance from OSHA on preparing the workplace for return to work. It's a pretty good outline for companies to look at in helping in developing their plans. That does cover sort of 5 main areas, which would include, not only creating a plan for a response plan, but talking about engineering, about control measures, as well as using a risk matrix for determining how risky each job is in your organization. A couple other points on this slide, just to briefly hit now, and then we can cover these in more detail in the Q&A session, which would be looking at areas where people have to contact hard services. So, and can you eliminate those or reduce those? And so you may want to create specific locations for materials to be dropped off and so forth, and try to avoid touching other areas in the workplace if possible. If there are doors, things like that, where people are always touching, then, and you can't avoid that, then that might be a point of concern that you would want to do additional measures to clean that or to disinfect it. And we'll talk about that again in a little bit. And one other point, in the previous pictures of the supermarkets, you saw people lining up. One of the things that some of the supermarkets have put in place, and you're all probably aware of this, is the one-way arrows. I think that most people haven't recognized those yet, but that's when you're passing people on a narrow aisle, you're clearly not 6 feet away from each other. But if everybody was going in the same direction, you can maintain that 6-foot buffer. So I think as a community, we need to pay more attention to ways where we can change our habits and try to protect that barrier. And one of those other points would be during shift changes. So if you have people coming and going at the same time using the same entrance, then you're not going to be able to protect that barrier, and try to figure out ways where you can stagger the workforce entry and exit, whether it's separate entrances, exits, or whether it's having a delay, and when maybe the line shuts down for a few minutes while there's a shift change. Next slide. Physical barriers are very popular right now, and everyone's putting up these plexiglass barriers in supermarkets, in almost everywhere I've been going recently. This is not a really great example. This is from a restaurant in probably in Asia. Not sure where this picture came from. So the theory is that if you have a protective barrier up, then you potentially don't need to wear a face mask or be protected, because that will stop the droplets in case somebody breathes hard and a droplet comes out, or something like that. It probably is not very protective, in my opinion, for somebody who sneezes, or if it becomes if we do determine that this is aerosolized, then it essentially will just go around the barrier, depending on the wind flow, airflow. So again, probably good for droplets from regular activities, but it may not be protective enough for others. And so I wouldn't probably rely just on this if the other activities or events could happen, somebody sneezing on you, etc. Next slide. Protective barriers don't always have to be plexiglass. They can be anything that can be wiped down, but it's essentially to try to stop those droplets, again, from going from one person to the other. Same thing as if both people have on a cloth mask or a face mask. Next slide. These are just some examples of masks, and we're all familiar with this from the news, and I'm sure everyone is now getting a little more comfortable in trying to wear either a homemade mask or other. As you know, N95s are very hard to get. They're not really required for most activities that would be in the workplace. I'm talking particularly to the manufacturing and sort of public-facing side versus the healthcare side. That's a whole different animal. Mortuaries and morgues, etc. Those does definitely need to have a higher level of protection, but for the general public in the workplace, under the OSHA guidance on preparing the workplace, that would be a sort of a medium risk for just interacting with each other for transmission. And so if everyone has their faces covered, that stops or at least reduces the droplet transmission. Next slide. Of course, in the ideal world, we'd all have gloves, gowns, and eye protection whenever we needed it, but that's not in the real world anymore. These are all either used up or are being diverted to the healthcare system. So for general manufacturing, it's unlikely that you would need to use this unless you have some instance or circumstance where you're going to have a high likelihood of being exposed to someone who's a COVID-19 positive person. Next slide. Dr. Hegman already mentioned some of the concerns about ventilation, but one of the things that I think is not being really expressed in the news yet too much, at least I have not seen it, is this whole concept of, even though you're maybe outside, you have your 6-foot pieces of tape on the parking lot at a retail store or whatever, waiting to get in. If the wind is blowing in a certain direction, then that 6-foot zone is probably not enough. You also need to think about this as you're doing your just your personal chores or enjoying activities outside. If you're say a runner and you're running behind other people, that buffer needs to be much longer than 6 feet, just because they're breathing heavily and the stream of particles out of their body will be hitting you in a bigger area. So just consider increasing that buffer zone depending on ventilation. And as far as inside the companies or organizations, the more you can do to increase the circulation of airflow, and this was covered last week, would be useful to increase the number of air exchanges, essentially what the technical term is. And also the HVAC systems can have HEPA filters put inside those, or attached. You might even be able to find the standalone HEPA filters that could filter air in certain workstations, but that might also help in reducing particles or aerosolization if that's indeed what's happening. And then finally, why don't we skip to the next slide? So finally, let's talk a little bit about disinfection. And there's a lot of stuff going on out there about how to disinfect things. The main things are to be consistent. So when you do identify in your workplaces where are the touch spots where people are either opening a door, pushing on a cart, whatever it is, then those are the areas that ought to be cleaned very frequently. And so we try to build that into your protocol of not only during shift, but before and after shift of making sure the workplace is as clean as possible. As far as the cleaning solutions go, we all know that soap works well, so it doesn't have to be an antibacterial soap. It's just soap, and it disrupts the envelope of the virus, and it removes it from the surfaces. So it doesn't have to be anything fancy. If you can find alcohol-based cleaners, that also works pretty well, but it does have to be a certain percentage, and the magic number is above 60%, and usually you can find them for 70%. Problem is that's not readily available on the market right now because of the supply chain hasn't caught up to the demand. But for organizations, I believe you can purchase that from some of the local distilleries that have converted from consumption to protection. Hydrogen peroxide is another example of something that you can get from a store or pharmacy and create your own solution, as well as bleach. And there are a number of recipes that you can find on the internet to create your own bleach solution, which works just as well as all the others. The main thing is just to make sure when you spray it on, you let it sit there for a little while so it has time to disrupt the virus, and don't just spray and wipe right away if you can help it. Next slide. I believe last week, for those that attended, there was discussion about how long the virus can live on different surfaces, and so we thought we'd just repeat that slide here. This shows that indeed the virus can live quite a long time on certain surfaces like cardboard for almost 2 days, and stainless steel or plastic 3 days. So just remember that that's probably not going to go away on many surfaces overnight. There was discussion about whether or not if you needed to disinfect a large arena if there's sporting events to come back, and on that one, as long as there's a time frame between the event and the next event where this would just die naturally, then it wouldn't require deep cleaning. I think you could apply that to your workplace as well. If you have areas that aren't used very frequently, then it may not need to be cleaned as deeply as some other commonly used areas. We don't recommend that you go out and put copper on everything, although copper does have a very short life. Virus has a very short life on the copper. So good to know for the Rio Tinto folks there. Can we go to the next slide, please? Just shows, essentially the actions of disinfecting. So on the left, you see people, cleaning areas where it's common for people to touch as they leave a public transportation, as well as tables where people will work. Next slide. Don't forget to clean your phones, because you're always touching something. Then you touch your phone, you put it back in your pocket or your purse or whatever, wherever it goes. So it would be a good idea to frequently clean your phone, as well as your computer mouse, especially if other people are using that. I know when we work in the clinic that everybody's fairly diligent in cleaning their workspaces, because you never know who was there just before you got there. Okay, can we go on to the next slide? As much as possible, if we could do regular hand washing as part of our daily routine, we would be able to make a big impact on the contact spread of the disease. So that's the people who have had droplets leave their body and landed on some surface that then we touch, and then we put that into our rub our eyes or something. And as you know, it's very hard to stop rubbing your eyes or touching your face. So regular hand washing would be encouraged in the workplace, and hopefully we can find ways to make that happen. Try to provide ways where people can get paper towels or such that they don't have to touch anything. So the dispensers, the automatic dispensers and so forth. And then having trash cans available right near the door. So when you open up the door, you can use the paper towel you had and then throw it in the trash can. This was kind of a leftover practice actually from our last scare back at Ebola and SARS and so forth. So this shouldn't be too new. If you can have alcohol-based hand rubs or disinfectants throughout the workplace, that also helps. You would think that everybody would know how to wash a hand, and so why would you put up display posters? But I think that we would probably be surprised that people don't know how to wash their hands very well, or they just decide not to do it. Can you go to the next slide, please? On the poster on the right is kind of hard to see, but you could probably download it from the World Health Organization. And there is a technique to washing hands. You can Google it on YouTube. I've seen the videos as well, but it's really making sure that you not only just wash your, put the alcohol or soap on your palms, but try to get the web spaces on both sides as well. So you rub your hands in between the fingers of each other. But the other commonly missed actions would be to make sure you wash your thumbs. So you're rubbing your thumb in the palm of your other hand, like a cue stick and a piece of chalk for those pool players that are the billiards players here, as well as rubbing the tips of your fingers into your palm so that you make sure that the fingertips actually get enough of the disinfectant on it and it gets underneath the fingernails and so forth. Next slide. Just examples again of non-touch paper towel type systems, as well as if you can turn on and off the water without touching it with your skin, that would be another good thing. Next slide. And finally, again, trying to make it such that people don't have to touch things. So if privacy allows, you can leave doors open or try to prop them open so that people don't have to touch those. I'll turn the time back over to Dr. Hegman.
Okay, thank you, Dr. Hughes. So the other things that we can still think about doing, even as we move from red to orange to hopefully yellow, is contact with the community can still be reduced or even eliminated in some situations. So use of online apps and phone interaction and so forth, of course, comes with zero risk. So the amount of time then can be limited in terms of working within a facility. Related thing is sometimes if you're able to do that, you can, for some businesses anyway, you can have half as many people, for example, in the workplace. And so that, of course, markedly reduces the risks. Okay, and next slide, please. Again, any means that is able to reduce that risk is good. That can include, glass barriers and so forth, even if people are physically in the workplace. Next slide, please. And indeed, another example. Next slide. And we're going to get into restaurants here, hopefully sooner than later, my own personal bias. Some of these old crowded places in big cities will have to do quite a bit more changes than we will in most of our places in Utah, but still the physical distancing to reduce our exposure with the community will be needed. Next slide, please. And we also added a few references on, along with Catherine's excellent list earlier. And I believe that's it for this set of slides.
Thank you, Dr. Hegman. With that, I think what we'll do is we'll start answering questions, but we also want to get into some questions that we've put together, and you'll be able to download or you'll have a link sent to you after this webinar that contains the questions that we will be addressing. They're thought questions to help you dig in deeper into the weeds of having a good plan in place. So we'll start answering questions, but we also want to start answering the questions that we put together as well. One question that has been given to us is the reality of this virus, is the reality of this virus that we need people to get it in order to develop herd immunity? We just don't want too many to get it at once to overwhelm the hospitals. Have we flattened the curve so much that it is just extending it out too long? I think this is a good one for you two, one of you two to answer.
Well, so clearly the short answer is we don't know. In this epidemic, we have many questions that are unknown. We will have a good answer in 3 to 5 years. And even then, I'll bet it'll be argued at that time. If, for example, we're unable to develop a vaccine, which so far there have been many attempts at developing coronavirus vaccines over the decades and have never been successful. So assuming there is no vaccine, then the issue of herd immunity and so forth becomes much more important. Clearly, one of the reasons I gave my opinion to close the schools when we did is to reduce the spread in the community, which would occur amongst the kids, and then it would pop into the adult population. That was a time-limited thing. My opinion is we should not close schools for any longer period of time. We should, at this point in time, try to get through this with a smoother, longer curve that doesn't overwhelm the healthcare system. Because I think the short answer to the question is that probably the thrust of this is correct.
Thank you. So we'll start answering some of these questions that we've put together as far as questions that we need to answer and ask ourselves when we're putting together our program. First of all, the first question on this list is, it's important that we determine key positions or critical operations in our operations so that we can protect that. Who or what key positions are critical to operations? How will we ensure that there is duplication in the event of an illness in key positions? And when do we allow an employee to return? These are all questions that maybe each individual business needs to answer.
I think that's all part of the business continuity plan. So, you know, as part of the planning process for each organization for reentry, I don't know that it's critical to add right away, but at some point having a business continuity plan as far as what to do if this reoccurs and they'd have to be shut down again, or how do you change operational modes from whatever your current operating level is to a different operating level. That's part of that. But as far as what I've been asked to help people or organizations with planning and whether or not people should be screened for temperatures or whatever else, I think a lot of that has to do with risk to the organization from the perspective that if those employees were not able to come to work, what would they just be shut down? So are there other measures that need to be done that are different for those critical people versus others? And so the part of the planning should be to identify those key areas where if like a group of operators or whoever that no one else has that special experience or training, if they go out, then everything shuts down.
Yes, and one of the things with our organization is that we identified key people that have to be in the building, and it's actually a greater risk to them if we have employees coming back into the building who could normally work from home. So we've minimized the number of people that actually go into the building to where it's only those that need to be in the building. So those are the things that we've looked at. We have key individuals that have to be in the building. All the others need to stay away because it's a greater risk to those individuals. As far as employing high-risk individuals, what we would consider high risk. What would we consider high risk? I know the CDC says 65 and older, but I've seen also that age 60 and over. What other risk factors do we need to consider?
So there's a lot of things. Like anything, there's no black and white on this one, right? You've got an issue of people have numbers of different conditions. If somebody is in very good health and otherwise is 65 years of age, they're not nearly as high risk as somebody who's got 65 years of age and diabetes and has had a couple of heart attacks and so forth. So unfortunately, this has produced if you read the CDC's guidance, it almost sounds like a black or white situation when it's mostly all gray. And then there's the wild cards of obviously of these tragic situations where people get severe disease and they're very young. I think the short answer is also involving the issue of how much contact there is in exposure. So for example, somebody who has much more contact with the general public is going to have higher risk because they're going to have more likelihood of getting the disease. So I think there's an added dimension which is generally not factored in that should be factored in. That helps.
Okay, we have another question here. What do you expect to see as people return to the office? Are they reconfiguring the layouts and furniture or just moving forward with reduced workforce, like 25% of employees coming in?
Good question. I think we've seen a lot of everyone experimenting to see what works best for their organizations. So if people are using shared offices, can they either alternate days or somehow find alternative workstations for them? Because it's unlikely you're going to be able to keep the 6-foot distance if you're in a shared office or a cubicle. So trying to definitely arrange your situation so that people can keep that. See, what was the other part of the question? Putting up barriers. We talked about barriers earlier. So we think they're good for just routine activities, but if somebody coughs or sneezes and they don't have a mask on, we know that those particles can travel way more than 6 feet. So, and they may go up and over a barrier or around it depending on ventilation. So it's not a fail-safe method.
And I'm personally seeing all of the above as far as staggered work shifts and, however people can do that physical distancing. You got to do what you can to maintain that. Another question that has come in, how necessary or effective are temperature checks, especially keeping in mind that asymptomatic people can still be carriers? What are best practices for administering these temperature checks? It's interesting, this question, because we actually, one of the things that we will be providing is a handout on the CDC guidelines for temperature checks and questionnaires and things like that to be used. But can you also provide, either of you also provide some information on this?
Well, Catherine, to date, I've not seen good data saying that this for sure works. So let's be clear. Our level of knowledge on this particular question is not what we would like. On the other hand, what do we know in general is people will oftentimes begin to develop fever and they may not be aware of it. And consequently, it probably will have some degree of efficacy. Whether we get that defined quickly enough, I don't know. But I think it's a totally reasonable measure. And I think this is all the things most people can do at home. This is not rocket science. And in fact, a lot of employers probably aren't going to be able to get any temperature probes right now, or it's very difficult. So if we start with, do they have any symptoms and what is their temperature and their A5 at home? I think that's a very simple, easy screen that any business of any size can do.
That's well put.
I've looked at that issue a little bit as well, and the practices are all over the board. People asking employees to put a temperature dot on their forehead, so as they walk past the screener, versus the ones you can buy for airports that are mass screens, and versus just the handheld infrareds. It's all over the board. I think one of the findings is that it's kind of like a drug screen, if you will, where it's almost a deterrent. So if people know they're going to get checked, they may not come to work if they're feeling some just regular cold type symptoms. That's one possibility, but we don't know the data on that. But the one thing to consider is that these thermometers are not super reliable, so they need to be calibrated. And I've had many people tell me as they've screened large numbers of people that most people are testing well below normal body temperature. So what do you do with that? And do you change your cutoff from the CDC recommendation of 100.4 down to like 99? And then if you're sending people home with a 99 on the reading, what is that? What are the implications of that if they're going to stay home for 2 weeks because they had a mildly elevated temperature? So I think those are considerations if you're going to put a plan in place for that.
And my recommendation is to get some advice from a medical professional if you can. We have nurses on staff, and so we're asking them to help us implement a program should we start bringing people back into the building. And there's also some privacy things that you have to follow as well. So it's kind of important that I see it as low-hanging fruit. It's one of the simple things that we can do, but there may be better things in the future that we can do. Okay, we've got some more questions coming in here. This one says, one of our businesses is to send technicians out to other parts of the US and internationally. How do we protect the employees from COVID at the remote location?
That's a great question. A couple things. One is obviously, ultimately, I think we will probably rely on antibody testing. So we should at least mention that issue as far as likely to convey at least some degree of protection. The second thing to be aware of is the degree of activity in any given location is now reasonably reported. The most common website to be used is the Johns Hopkins website. You can see the degree of transmissibility in that location. So I think you should know that in advance. The third thing I would say is travel on the airline with a mask, and right now they're trying to do distancing on airlines, and I guess it's not that hard at the moment, unfortunately. But that's another thing, is the transit issue. And then on the return, the other issue is, do you or do you not have them work from home or be out of the office for a period of time so you did not bring somebody into the workplace? I think that's an individual situation. You need to look at where do they work in the plant or the business. Are they key critical as a way that they can get in and out without, even if they would come down with it, without taking out a critical business operation and so forth. So there's a lot of variables there that need to be addressed, but that's a very rough framework. And Dr. Hughes has certainly had a lot of experience with international things as well. He may have quite a bit more to say.
So what I've found, or what I've heard, is that some of these international locations may be requiring a negative COVID-19 test before they're allowed in the country. So that's something that you would have to consider. What type of test they're requesting. Are they requesting the PCR test, which is the one that they're doing through the drive-through testing sites, or the immunoglobulin test to see if somebody's been infected and has mounted some kind of response to that. So be aware of that. I know in other remote locations where people are going, particularly offshore or other remote sites, and there might be a group of workers together, that they're actually quarantining them in at a hotel for several days before they then go on site. So depending on if you have large groups of people going somewhere or just a single person, there may be some consideration of it's like a self-quarantine before they go on the other work site.
Okay. Another question here, and I know my answer to this question, but I want to hear yours. Should masks be a requirement in an office setting? It's my personal experience that masks were minimized for so long, and they're actually so effective at stopping the spread. But what do you two say?
I think, to me, there's a few variables here that should be highlighted, because the question really doesn't say what is the proximity to other people, what are the barriers, and so forth. So if it's an office that has individual offices and so forth, that you then have the ability to work in that protected space. So you saw actually my office in the diagram, and there's more than 6 feet distance. In fact, most of the offices in our suite are that way. I actually don't think it's necessary in that situation to wear a mask. On the other hand, we've got cubicles which are close to each other and that sort of thing, and I think that that's a different story. And so I think it actually depends.
If you ever go to the bank in the last couple of days, I think there's this false sense of security that if you're colleagues and you've been working with each other for a while, that you don't need a mask on, but you have no idea where the other people have gone. So those sort of public-facing businesses like banks and restaurants and so forth, they're very comfortable around their own employees or with each other, but then the public is the enemy, right? They're the ones that are going to bring it in. So there is a lapse that I've seen in a comfort level between coworkers where there really should be more caution, I believe.
Well, and for example, in our office, we pretty much have very few people going in, so we haven't required masks in the building yet. But when we start bringing people back in and they're in close proximity to each other and we can't maintain a good physical distancing, we're going to require them. So it really does depend on how close you are to people and that sort of thing. Another question here, we cannot find the needed supplies for cleaning. Are there state or other resources to help us purchase what will be needed? Are you two aware of anything like that?
I am not. I frankly have not looked for bleach lately, but that's one of the things which generally has not been in terribly short supply. The alcohol-based cleaners, of course, got cleaned out of the stores very quickly. And I think there's also one of those areas where the answer is going to be variable, where over a period of time it's going to be backfilled with orders in the supply chain coming up. But I'm sorry, I don't have a more erudite answer.
I think it's a challenge for everyone across the board right now. I think it was Dr. Hughes, you mentioned that some of the distilleries have switched over to manufacturing hand sanitizer, and that's where we have placed an order with some of the local distilleries as far as that goes. But it has been pretty difficult. I know just personally for home use, we finally were able to get some bleach at Costco, but hadn't been able to for a long time. So it is across the board pretty difficult for everyone. So maybe if we could get people's heads together on that, then we'd be a lot further ahead. Another question, as a restaurant owner, you can ensure 6-foot spacing is adhered to in the front of house, but it is more difficult when you factor in other areas like restrooms. How can you ensure it is reasonable and safe to open any dine-in operations? You know, this brings up a few different things. For example, the restrooms, one of the things that we have on the list is how do you physically distance in an elevator or a restroom, or do you know, those kinds of things. But back to this question, how can you do this? I know you had pictures of a restaurant, but how do you control people going into the restroom? That's a good question, I think.
Yeah, it's a very good question. I mean, clearly there's an individual responsibility question. This is probably too much detail. But the frank facts are, if one uses your own private restroom, before you go to the restaurant, you probably are not going to need to use the one at the restaurant. So, you know, there's an issue here of all of us can reduce our need to even use the facilities. The second thing one could think about doing is if there's a way you would know how many people go into it at any given time. Yeah, I mean, if only two are in there at a time, that would be another thing. The third thing that really may be more important than anything in a restroom is probably ventilation, because the room usually has pretty good exhaust ventilation. So you may want to make sure that the exhaust ventilation is always on and on high, because that would then provide quite a bit of improved safety.
Any other ideas for restaurants, you know, making sure that their operation is, the dine-in operation is safe?
I'm not a restaurateur, so I have very little insight other than I eat out every day. But what I would say is maybe you can, if it's a choke point where people have to pass in the corridor, have the line start at that choke point, and then people will just have to queue up, you know, to use the restroom. So you know, you wouldn't be able to. I don't know if there's a red light, green light type thing, but you lose a little bit of privacy because you have to stand in line for the restroom in a safe area.
Yeah, if I can add, a couple other things have been discussed and put in some materials online regarding restaurants. One of them is, one of the choke points is certainly entering and exiting the restaurant. And there are ways to facilitate that flow, including how you pay for the services and also seating and also ingress, egress. The other part of this, of course, is the spacing of the tables. And I think a third area is the issue that in a restaurant, that's one of those places where you could wear a mask going in, and then you, of course, would not have it on for consumption, but then you otherwise would have it on. So there's some additional safety factors which can be built in for restaurants, I think, which are not necessarily, you know, completely control of the restaurant owner, but I think that could be done. Signage to request that sort of thing could be there too.
Okay, well, it looks like we've pretty much run out of time, but if you still have questions, we can try to help get answers. You can email answers@saltlakeChamber.com. Also, just please note there is a webinar coming up on supply chain on May 8th at 10 a.m. that might be able to answer some questions as far as getting supplies for different things for COVID. We thank you for joining us, and have a great rest of the day, and make sure you stay safe and healthy out there.
Thank you.
Thank you.